This episode of the Ortho Show is brought to you by Veradigm. Some healthcare technology companies deliver clinical data for biopharma and health plans. Some help turn that data into insights. Others serve healthcare providers directly by providing point-of-care clinical software. Only Veradigm does it all. That unique combination added to our nationwide scale is why so many leading healthcare companies choose to be a part of the Veradigm network, working together with Veradigm to transform healthcare insightfully. Whether you're a healthcare provider, patient, biopharma company, or payer, check out www.veradigm.com. That's www.veradigm.com to learn how Veradigm can help you too. So this is a fun episode. We do so many different things. We have the most amazing professors in the world, but every once in a while we want to bring some people in who are in training so we can really educate and talk to our listeners that may be in medical school or thinking about orthopedic residency. So we have Dr. Kyle Kunze on, who's the chief resident at Hospital for Special Surgery right now. We talk about his whole process through the training program, where he wants to go to his fellowship, but also how he's so involved with relationships very early on. He's already on editorial boards. We work together for the social media board for Journal of Arthroscopy. He's published a gazillion papers, but he's also involved early on with a lot of startups, and he has a lot of great information about artificial intelligence and virtual reality training, all of that stuff that we've talked about. This is going to be a lot of fun. You're going to really like this episode, as you always do. Dr. Scott Sigman, hashtag follow the fro. We'll see you soon.
From medical media, this is The Ortho Show.
Hello world, Dr. Scott Sigman, your favorite opioid-sparing orthopedic surgeon, here for another episode of the Ortho Show podcast, where everyone knows we bring you the best of the best. I am super excited. We have one of my absolutely favorite up-and-coming orthopedic surgical stars, and that is Dr. Kyle Kunze, who is a chief resident and orthopedic surgeon in the residency at the Hospital for Special Surgery, otherwise known as the Hospital for Surgeons' Sons. Kyle, how are you, brother?
I'm doing well, Scott. Thanks so much for having me on the show today. Really excited to be here.
No, I love it. A little bit of history for our listeners. You and I have really gotten to know each other well. We served together on like a social media board for the Journal of Arthroscopy, and every 4 to 5 weeks we would get together and have to do all this stuff, popping it on the computer. And thank God I had a young, intelligent person who knows about all that technology, because you were a whiz and you made it awesome for us. So I thank you very much.
Oh, thank you. It was a good experience. I think we learned a lot together, so it was fun.
No, we really did, right? We got to review the
Yeah,
literature as it was going on. It was like journal club
that's
every
right.
5 weeks, and
That's
then
right.
I had to learn all this newfangled stuff on the computer to be able to do all that stuff. So it was a good time. So listen,
It was.
Kyle, we have a lot of young listeners and orthopedic surgeon, residents, medical students, people thinking about this. So I think this is going to be a great episode to sort of share your experience and what you're doing at this point. As everybody knows, when we start the show, we always start with the same place. It was when and where. I think you're a Jersey boy, if I'm not mistaken, but give it to us. Where'd you grow up?
That's right. That's right. I grew up in South Jersey. It's a town called Collins Lakes. It's like 40 minutes south of Cherry Hill, about 30 minutes southeast of Philadelphia, and 30 minutes from Atlantic City. Raised by my two parents there. Neither of them actually completed high school, so I was the first to go off to college and medical school. I had the opportunity to play varsity football at University of Chicago, Division III program, so go Maroons. Um, and then I had the opportunity to stay out there for medical school at Rush, which was fortuitous for me because I always imagined coming back east for my training. Didn't get into a ton of medical schools actually, and Rush ended up working out for me. And I didn't realize at the time how strong of an orthopedic program and department they had. And so from there, I ended up diving right in and making a lot of mentors and good connections in orthopedics who I learned just so much from clinically in terms of research, and just made some everlasting connections that helped me make my way back to HSS for training. And now it's an interesting time. I'm in the middle of, well, actually finishing up interviewing for sports medicine fellowships, which has been an exciting journey and getting to see a lot of familiar faces and meet a lot of big names in the field.
Kyle, you ran through the whole damn podcast in like 3 minutes, dude. What else am I going to talk to you about? No, I'm just kidding. Come on, let's go. Let's roll the beat footage backwards a little bit, and let's enjoy the moment. So you're in Jersey. Obviously, you're a football player. You're going to go to University of Chicago, and I'm assuming, it's always the same story, right? You're going to go do a sports medicine fellowship. So somewhere along the way, you had some sort of an injury, in football that sort of stoked your imagination about perhaps being a doctor in orthopedics. So where did that come from?
Yeah, so I started playing football when I was 5 years old. And when I was in fifth grade, I was going to make a tackle against one of the teams we were playing, one of the defenders, and my elbow hyperextended, and I sort of landed on it funny, and I ended up sustaining a medial epicondyle fracture. And so I had that fixed at with a single screw at Children's Hospital of Philadelphia by Dr. Larry Wells, and that kind of changed my whole perspective on things. And I was just so interested in what a hospital was and just how comfortable he made me and my family feel. And that was kind of the path I got set up onto.
Yeah, because it's interesting. I mean, your parents are doctors, and so did you have any other family members or close relatives or anybody that could be a mentor as far as doctoring and the whole orthopedic thing, or just that all had to come on its own?
No, it actually came on its own. I feel
Yeah.
like a lot of people kind of have those types of connections, but it was just something that interested me so much, and I was interested in sports, and it was really just the feeling of comfort and the help that he was able to elicit, that really made me interested in pursuing medicine and science.
I love it. I mean, we all have these stories. One of my favorite stories is I was at Tufts. I went there to play football and lacrosse, but somehow along the way, I decided it was only going to be lacrosse when I saw how big the football players were and how big the playbook was of the first week. I said I'm going to try something else. But anyway, so I'm playing fraternity football. I twist my knee, I pop my knee, and sure enough, I go to J.R. Richmond, who's the team doctor for
Mhm.
Tufts at the time, who's one of the iconic sports medicine legends. And he has to scope my knee. And then let's fast forward to like 8 years later. And JR's like, why should I take you? I'm like, because you scoped my knee 8 years ago and it really went well. So you should take me as a visit now. So it's funny how those stories come to be.
It
But
is, yeah.
so,
It's fun.
so
It's funny, but when I was interviewing for residency, actually, I ended up interviewing at Penn, which is one of the places, and it turns out that Larry Wells was one of the interviewers who had fixed my elbow when I was 5 years old. So it kind of came full circle, and he
that's
put
the
me through
same
a little
story.
exam.
I
Yep,
love
yep,
it. I love
exactly.
it. Did he
Yeah,
examine your elbow during the
he
interview at
did.
that
Yeah,
point to
that
make sure he did a good
basically
job?
basically
I
the whole
love it.
interview was an exam.
I'll never forget my Penn interview. It was in the middle of a snowstorm, and I basically gave myself like 6 hours from Baltimore to get there. I showed up like 15 minutes late, and I was all disheveled. And they were one of the few programs, Kyle, that would actually let you know where you ranked, like what your number
Hmm.
was. You
Yeah.
could call like a couple weeks later or whatever. And I'll never forget the secretary. She's like, "Oh, honey, I feel really bad. You're like number 72." I was like, all right, lesson learned. Give yourself enough time in a snowstorm to get to your interview so you're going to be
That's
okay.
right.
I love it. All right, so University of Chicago undergrad, and at that point in undergrad, you're playing football Division III program. And are you dialed in at that moment? You're like, I am going to be an orthopedic surgeon at this point?
For sure, yeah. That was always the path. I wanted to keep an open mind, but I knew I had a pretty strong interest in orthopedics. And it's funny at the time because, again, I always had this mindset and goal of becoming an orthopedic surgeon, but I was almost so narrow sighted that I missed a lot of the things around me. So, for example, the team doctor at the time was Bruce Rader, um, who was obviously the editor in chief at AJSM. And so I feel like that's a connection I would have loved to try to foster and while I was there. But so yeah, after that, I dove into a lot of basic science research at University of Chicago and majored in biological sciences, with the intention of applying to medical school.
One of the things I've recognized in the new breed of orthopedic residents is that, it is not easy, right? It's not easy to get into a program. And, unlike it back in the day when I was there in my residency, we were a surgical residency. I mean, we got educated, we did this, we did that, but there was really no pressure to publish, publish, it's parish or publish and parish or whatever. That is not something that we experience. But nowadays I feel it's there for everyone. So I found it remarkable that you're like, you're making relationships, even thinking about it, with your team physician all the way back to college where you could have had that relationship. So I find for our listeners out there, you cannot start too early when it comes to developing relationships and even identifying research projects. I'm sure you'd agree with that, Kyle.
I would totally agree with it now. And hindsight's 2020, and now I think I tend to value and look for those relationships more. Like opportunities through Anna and some of these specialty societies, and really just throughout residency, whether they're physicians or providers in your specialty, or just people that you can kind of empathize with or bond with. I think there's something to be learned from all these people, and you never know what one thing's going to lead to.
Yeah, I think that is really spectacular advice and definitely something that we've seen because we have interviewed a few residents and fellows along the path as well. So you stumbled in to Rush University for medical school. You're deciding you're not going to leave Chicago, and all of a sudden you recognize that, wow, there is a kick-ass orthopedic department at Rush, and I'm in the midst of it. So tell us about that.
Yeah, so that was fortunate to realize that so early, and I was happy to try to take advantage of that, knowing the path I wanted to be on. So I think within the first month or two, I cold emailed 5 or 10 people from Midwest Orthopedics, saying, "Hey, I'm interested in going into orthopedics. I want to do research. I want to get involved. How can I do that?" And one of the few people that responded to me was actually Shane No, who's a high volume hip arthroscopist out of Midwest. And so I started doing research with him, from my first year all the way through the fourth year. And he became one of my biggest mentors and supporters. And through working with him a lot, and also a lot of the fellows that passed through the Rush program, I was able to leverage a lot of these new connections, just try to soak up as much as I could, learn about research and in orthopedics.
I love it. So I'm assuming we should get Shane on the show, right? I hear he's a pretty dynamic guy, if I'm not mistaken. So we'll have to work that connection, Kyle. You'll connect us for sure. And
That's right.
I'm sure you were hanging out with Brian Cole at that point. Brian's writing books and becoming a professor in biochemistry and all this crazy stuff that he does. And Nick Verma was there too, I'm assuming as well.
Yeah.
But
Yep.
Jorge wasn't there yet, I'm assuming. No, Jorge was still in all his fellowships.
Yeah, Jorge did his fellowship at Rush when I was a third year medical student.
I see.
Um, so I was able to run into him, and actually Jorge is one of my biggest mentors now, and someone who I talk to often, and really just an overall just generally wonderful person. And so he's been someone who I can always go to for career advice, research advice, and I've learned a lot from him as well.
Yeah, he is a phenomenal orthopedic surgeon. He's multilingual. He is an absolute rock star around the world for the things that he
Mhm.
does and has an amazing social media brand as well. Jorge is a friend and has been on the show as well as an Ortho Show alumni. So you must have done pretty good. You're at medical school, you're deciding you're going to go into orthopedics, which is not easy. But you get into HSS and nobody gets into HSS. How'd you get into HSS for residency? Tell us about that.
Yeah, no family connections. So again, I've learned so much about this process that one, there's no substitute for working very hard, and I think that's a value that I learned from my parents, having to work really hard in their jobs to support me, not having gone to college, and so that's a work ethic that I carry out or try to throughout most things in life. But I think one thing that set me aside was the network that I'd built as a medical student at Rush, and also really the research productivity that I was able to accomplish under the guidance of all those mentors I made at Rush. And I think besides just the interview going over well at HSS and those external factors, I think it kind of pushed me over the edge a little bit to be lucky enough to have that opportunity to go to HSS.
Yeah, and I think one of the things we hear routinely about on the Ortho Show, there's a couple words that always come up. Mentor, you've already used it a few times, and then relationships. You cannot start too early on
Mhm.
developing your relationships. And I'll tell you, the people that are in these academic centers, it's pride for them to have their students and residents do well and be able to succeed. And so they're open arms. They want to help you. So don't be shy. To all you guys out there that are listening about wanting to go into this, find and identify the biggest name you can find. Give them a call, email them. By most likely, they'll get back to you and want to work with you as well.
Yeah, I've
All right.
I've been
So
really surprised by that, Scott. I
yeah,
sorry to interrupt, but
yeah.
but
Please, please go ahead.
even as a resident, I feel like a lot of times you feel hesitant asking, some of these physicians who have been in practice, 20, 30 years or whatever it may be, to maybe reach out or make a call for you. And some of these mentors I've had at HSS even, they've been like they've essentially told me, this is part of the process. This is what we do. We were there. We love to give back. And so I agree with your advice. I think you shouldn't really hesitate. The worst that someone can say is no. And I would say the vast majority of people have been in your position and they want to help you whatever way they can.
Yeah, no, I completely agree. Even the biggest stars, the ones that you think maybe are not approachable, trust me, just give them a call, send an email, make the connection, and more often than not, they're the sweetest people on the planet and they want to
Hmm.
help you. So I think that's really, terrific advice. So what's it like at HSS? I mean, are you working hard? I mean, I know it's 80-hour work weeks these days. You guys got to get your teeth cleaned. You got to be able to, you know, get your brakes changed at the car. You guys have all this extra time in your life now. But no, seriously, one of the, we had Monty Sabizan on the other day, and she's
Hmm.
directing the program, down at University of Miami, and she had a really cool idea, which I think might really work well in the residency, which is enough of this, service side, right? Because you guys don't get as much reps as we used to, and there's been a lot of didactic training in the past, but instead she's like, man, let's get him in early, like early process, assisting, getting in the operating room, getting reps to hold the scope. So how much hands-on stuff are you getting there? And as the training, you gotta be, of course, you're going to say it's great training, but give us the inside scoop.
Yeah. Well, look, I think whatever program you're at, there's certain key kind of milestones and foundational concepts you need to learn early on that may not involve surgical repetitions. As an intern, you're drinking from a water hose, is what they like to say. You need to just kind of learn your way around the hospital, learn how to triage patients, understand what's normal and not. Second year, I think a big component is learning how to take call, be an emergency room resident, learn the principles of fractures, reductions, kind of start to get your chops in the operating room. And beyond that, especially at our program, I think, PGY 2 and 3 years when you really start to operate a lot. And one of the benefits of being at a program like HSS is that there's so much volume that you can always find repetitions. And most of these people, the surgeons, they have 2 rooms. So there's a fellow room in your room or a physician assistant room in your room. And there's, another benefit is just seeing so many things done differently. So I think it's been a wonderful place to learn how to operate.
Are you getting some game coverage as well? What do you guys do as far as sports medicine team coverage?
As a resident, the most team coverage is through the PSAL, which is the Public Service or Public School Athletic League in New York. And so I cover a high school team in Brooklyn Lafayette High School. And
Cool.
so I'll go to most of their home games. They cover kind of a wide range of high schools throughout Manhattan, Brooklyn, Queens, in the Bronx as well. So that's been a fun experience to get some team coverage experience, learn some sideline management. One of the doctors actually who will come out and cover Lafayette with me is Mark Sherman, because the field's actually named after his father, Seth Sherman's grandfather. So it's been wonderful to get to learn from him a little bit.
Yeah, Seth and his father just published their book, and there are 3 generations. Well, the grandfather was actually a general surgeon, but was still doing
Hmm.
team coverage, which was really cool. That's a phenomenal story. And of course, the Sherman classification for ACL tears comes from Seth's father as well. So
Correct.
The Shermans go way back in orthopedic lore. So I think that's fantastic. So obviously you're having an amazing experience. I love the fact that HSS helps to subsidize your apartment. I can see either you have really small feet or your wife does because you got your Peloton shoes behind you over there. I can see that. So
That's right. Yep.
we
Yep.
we love our Peloton.
Yeah, we have a great setup at HSS. It's been a wonderful time to train here. I would certainly do it again. The training, the perks, the mentors, the network you make. I think it's all unparalleled, and so it's been a wonderful opportunity.
And obviously, you've taken advantage of everything you've done. I mean, again, I've had the pleasure of working with you this past year, and could just see your diligence, your energy. You're always getting things done. And I'm not sure, has the fellowship thing been decided yet, or are we still sticking around waiting to hear at this point for your sports medicine fellowship?
Yeah, so the official match is in a few weeks in April. Um, there's always a little talk behind the scenes, but so it hasn't officially been decided yet. But I have my idea of a few top programs that I'd like to go to.
What's your number one choice?
At this point, Rush is my number one choice.
Heading back to Rush, and we've had just a
Yeah,
litany of Rush fellows, sports medicine fellows, exceptionally well trained there again. So you're going to be, you'll be ready to rock and roll, brother.
I hope so.
You've got academics written all over you. You're not going into private practice, Kyle. Come on, right? Am I right?
Yeah, it's my plan's academics. Yeah.
Yeah, you're a natural born academic. The issue is going to be for you. Hopefully, you're starting to work your relationships already now, right? Because that perfect academic job in sports medicine is not easy to come by.
No, I'm learning that too. And there's some things that you're not really taught that well in residency. Obviously, there's a big clinical focus, but I think the business of medicine and understanding, differences between practice types and payment models and things like that aren't always so well explained to you. And so, yeah, I know that the hiring cycle and what the market looks like can be unpredictable. So again, going back to that network, I think it's important to try to leverage that to hopefully set things up for when fellowship ends.
Yeah, I don't think you're going to have any problem. I mean, you may have to take a year or two before the right thing really opens up, but you never know. If you work it hard and you'll be prepared, which I know you will, I'm sure you're going to get an amazing opportunity. So one of the things that I've also recognized about the new breed of residents, are you a millennial? What are you considered? I don't even know. Are you a millennial?
I think so. I'm actually not sure either.
What year were you born?
93.
Yeah, you're a millennial. You're right smack in the middle of it. And so, what I found is that you guys are like, I don't really care about the rules. Like, I'm gonna like start talking to companies and in startups, and I'm gonna try and get my name on a board somewhere and do back in the day, I was like, there were computers, there wasn't the internet. You really couldn't do that stuff, but now you can be incredibly well connected.
Mhm.
So you have a lot of outside interest already that you're developing, with outside of being in the operating room or seeing patients as clinical as well. So tell us about that.
Yeah, I think you're exactly right. I mean, in this day, with all the social media, with the ease of access with networking and talking to people, with how fast technology evolves, there's just so many opportunities. And if it's something you're looking for, it's out there. I mean, one of my first sort of things I wanted to do was, as a medical student, I had the opportunity to join the editorial board of arthroscopy. So always just kind of looking to push yourself to get to what's next. Right now, I'm really interested in artificial intelligence and um, both in research applications, but also, as you alluded to, on kind of on the startup side. So talking to some companies and seeing if there's a role that you can be involved in, whether it's consulting or the innovation side.
I love it. All right, so you brought up AI, right? And so forever, like orthopedics and sports medicine was just like stuck in a rut. We did a lot of really cool stuff in the late 90s and early 2000s. It really sort of we had this sort of blossoming of sports medicine and stuff. But then after that, it just stuck around. We were using the same shavers for 20 years. Everything was plugged into the wall or plugged into the TV, and all of this amazing technology is happening outside the operating room, and we weren't really there to appreciate it. But really, in the last 5 to 10 years, things have really started to accelerate. Where do you see AI in orthopedics? Where do you think is a great application that's going to really help us to do a better job caring for patients?
Yeah, it's a great question. I'll try to make the answer short because realistically, I see as it evolves, it's going to impact pretty much every component of an episode of care, and really will have a big role in injury prevention as well. So if you think about kind of all the technology and all the data we have now, for instance, if you think about an NBA game or NFL football game, now we have cameras on players all the time. Amazon's involved in some of that. You see like holographs kind of on the field when you're watching on TV. So I think the first application of AI will be using video data from practice or professional games to identify abnormal kind of movement patterns or abnormal biomechanics that are being demonstrated by some of these professional athletes. And you could leverage that data to say, hey, you're cutting too soon, or you're landing, in a valgus moment. These are the things that we need to work on, because we know, based on all this large data, that you're going to be at increased risk of injuring your ACL based on your movement patterns compared to a control.
And
Um,
obviously
yeah,
you're going to use that for fantasy football for your drafts, right? You're going to go back to the college data and identify the guys that are jumping the right way and have
yeah,
good mechanics, right? They're going to have a longevity in career. I know my sons will be listening because they're big fantasy football players too. But we're not going to use it for gambling. We're going to use it for improvement in orthopedic care for our patients for sure. So that's a cool
yeah,
one.
yep.
What about like patient outcomes, like patient reported outcomes? Where do you see we're going there? We just had an interesting guest on talking about that as well.
Yeah, so I think there's going to be sort of an integration of multiple AI modalities that essentially can augment rather your clinical decision making process. So I kind of view it as two arms. There's like an imaging arm, and there's a clinical medical information arm. So from the AI medical imaging arm, when you see a new consult who has a history of knee pain with maybe some acute injury, you're going to have maybe an X-ray and an MRI of the knee. Um, Obviously, there's some quality control concerns for where the patient gets the MRI. Your time may be limited in comprehensively viewing the MRI, as is the radiologist, given the patient demand mismatch, where we don't have a lot of time to spend with patients, but we're overwhelmed by the amount of patients we need to see. So I think in considering both those things, we'll have AI automatically kind of annotate and perform all the clinically relevant measurements or diagnoses on these images, where you can sort of change them and augment them if you don't think the angle is, just right. But it'll have it there for you and kind of spit out the values or numbers that you routinely use. On the medical information side, I've done some research in this field where there's you can essentially take a patient's risk profile given all their demographic data, all their history, and perform some type of some risk prediction for an outcome of interest. So that may be the patient's likelihood of achieving the MCID or a clinically meaningful difference after a procedure. It may be their risk of readmission. And a lot of times these calculators incorporate imaging data to make their prediction more accurate. So I see those two components kind of being integrated into these risk prediction tools that'll be available for you in a clinical setting, that you can use while you're talking to these patients and give them a visual of why they may be a good
I
candidate or
love it.
not for a
So,
procedure.
we're isolationists as doctors, the way we've been trained, right? You get all this great training, and then you go into practice, and then you go into an exam room, you meet a patient, you look at an MRI, and then the two of you get together and you make a decision. 90% of the time, you're not running out getting consensus, you're not calling all your buddies, you've been taught on how to do this. But let's take like so for AI, what they'll do, right? You'll get like a gazillion MRIs of the knee, right? 25,000 MRIs of the knee, feed it into the computer hard drive, and then it learns from all that. It can see what a medial meniscus looks like or a cartilage defect there. And then it will actually be able to provide you, clinical information based on all of this data versus the MRI report from the radiologist, which I get one out of every 25 that says normal knee when there's a displaced bucket hit meniscal tears. So, I mean, it provides a lot more information. Then on the demographic side, I really like that too, Kyle, the way you described it, because again, what it's doing, it takes all of these variables that are in there for that individual patient and then historically compares it to others, and it can give you feedback on what maybe the best care plan is for that patient. Really pretty
Sure.
cool.
Yeah. I mean, if you look in the literature, I think, you see all these independent studies looking at one or two risk factors for an outcome. You see another study that looks at another one or two risk factors, and you start to think about it and you realize that really this can't apply to all patients. Uh, you can't generalize this to every single patient. Everyone's different. Everyone has their own specific makeup of risk factors, medical profile, imaging findings. And so I think some of the power that you can leverage through AI is really considering all of these risk factors together that are available to you to give you a more informed assessment and better decision making for a treatment.
No, I love it. I love it. Love it. So, another area that I think would be really fascinating, and I'm involved with a company, Caliber AI. You've been talking with them as well. Let's bring AI into the operating room. Like,
Yeah,
think about all of the images that have been done for a rotator cuff repair, right? I'm like, how many hundreds of thousands of rotator cuff repairs? If we could get the images from Brian Cole and Jorge Chala and Bill Levine and Loren LaFosse and Pascal Bouillot and get all of that data and put it into the computer, and then the computer can learn from all those. And then when you're in the operating room, it's like, oh, hey, dude, that's where the tear is. Put your anchor in over there, and you should try
Yeah,
this type of repair. Wouldn't that be cool?
it'd be amazing. I think it'd be game changing. And even especially not only for that, but from a trainee perspective, if you're, helping out with a case or you're in a cadaver lab and you have this technology available and you're a young trainee, trying to learn how to put in anchors for a rotator cuff or drill a femoral tunnel for an ACL, if you had some technology to help guide you based on data like that, it would absolutely be a game changer.
So let's throw something else in, because I want to give you a big shout out, because I was there when you were awarded your paper for virtual reality. In particular, Precision OS really seems to be leading the way in this regard, Danny Goyle's company. So tell us about what your experience was with virtual reality in your ability to train, and is it legitimate? Like, is this the real deal? Does it really help or not?
Yeah, I'll say I saw Precision again after that as well, and at the academy, and I used some more of their software besides this study, and I've really just been so impressed with what Danny Goel and Precision's kind of been able to do and where they're going. I tried sort of what we were talking about, using the VR headset to go through a rotator cuff repair case, and it has all the steps of a case. There's still some things that they're working on in terms of tactile feedback, the exact precision as it relates to what a real case would go like, but it shows you step by step, like where the anatomy is, where anchors should ideally go, what the steps should be, where the anatomy is, so as a trainee also, maybe where the risky areas are, maybe places that can get you into trouble. And so the other part of this is the convenience. Some of the simulators we have cost hundreds of thousands of dollars. You have to go to a lab to use them. But the VR headset, I mean, you can sit on your couch and use and practice some of these skills. So I think if there was sort of a systematic and dedicated program that trainees were required to complete, during the rotation or throughout residency, I can only see it being beneficial.
And how did your paper validate the process, just for the listeners as well? I'd like to share that.
Yeah, so the paper compared the use of a VR headset for hip arthroscopy training and their modules versus a traditional Vertimed base model, which is sort of a larger construct that you have physical arthroscopic equipment that you sort of use to help complete tasks. And it compared the training on those two modules after completing a cadaveric assessment, which we had some people like Brian Kelly, Anil Ranawat, Greg Galano from Lenox Hill kind of moderate those and grade us on skills. And essentially what it showed is that the skill acquisition and performance are similar among the two constructs, with the exception of the Vertimed headset is actually like 8 times cheaper at least and more convenient. So again, I think that's where the major difference is. Obviously, there's no substitute for doing the real thing, but I think using augmented reality in that manner will be pretty close.
Yeah, no, I think that's awesome. And it's so cool. I mean, literally, so Danny, myself, and Sharif Bechet are doing an arthroscopic rotator cuff repair. I'm literally in my basement next to my Peloton. I put on my VR goggles. I'm in Boston. Sharif's in Detroit, and Danny is literally in Vancouver. And we're going through one of these rotator cuff modules, and we're literally high-fiving each other with haptics. You can feel it. I mean,
Yeah.
it is just so cool. But yet it also really does help. I mean, for me, in my education, it was, you went to cadaver labs if you were lucky, and it was just reps, reps, reps. And like being able to practice outside of the human body really helps in your proficiency. And I think it can really scale education. So I think it's really great to hear that you were able to validate with your paper as well. Listen, Kyle, this was awesome. This was a great experience, for so many of our listeners to get to listen from someone who's literally going through the process of getting through residency into fellowship. You are a remarkable man. I think the work that you're doing, your dedication, you just have to, I need you to put a little bit more effort into your career. And then I think other than that, you're going to be great. Now, what a pleasure it's been to have you on the show, Kyle.
Scott, I'm really grateful to be on the show, and thanks so much for chatting with me and having me on. It's been really fun to talk to you.
Yeah, we'll be friends for a long time, brother, for sure.
I hope so. I hope so.
Absolutely. This is Dr. Scott Sigman, hashtag follow the fro, host of the Ortho Show. Till next time.